When it comes to their healthcare plans, many small and mid-sized schools feel like they're trapped in the old-fashioned, fully insured marketplace. Year after year, driven by seemingly irrational rate increases, they've had no choice but to water down benefits and pass along the cost increases to faculty and staff. Traditionally, large employers have been able to take advantage of a technique to avoid getting stuck in between that rock and that hard place. How have they done it? With a partially self-insured plan that allows them to transform from being renters of their healthcare to being owners of their healthcare. In fact, 3 out of every 5 American workers are already in a partially self-insured plan. Most just don't know it. That's because from the outside, partially self-insured plans look just like any other healthcare plan. Employees use their benefits, claims are filed, and claims are paid. The big difference is all behind the scenes. How does it work? In a fully insured plan, the school pays an insurance company that manages the claims and pays out healthcare costs incurred by employees. Of course, the insurance company also pockets a profit, and at the end of the year, they get to keep any premiums that are left after claims are paid. In a partially self-insured plan, the school pays for some of the more predictable claims directly and contracts with a health plan administrator who handles the claims administration. To deal with those less predictable and generally more expensive claims, the company purchases what's called stop-loss insurance that pays any claims over a prearranged amount on any one individual, as well as claims that exceed a prearranged amount for the entire school. This transfers the risk of those large and unexpected claims to a third party, which creates a more stable financial environment for the school. There are other advantages to being partially self-insured. It helps schools manage their cash flow. The school holds money to pay healthcare claims during the year, and that money can earn interest. The best part is that if there are fewer claims than expected, the school gets to keep the difference, and there's no insurance company profit to pay. Partially self-insured plans are also subject to fewer state and federal taxes. One partially self-insured plan can cover faculty and staff who work in multiple states without the hassle of a different plan for each location. Schools who partially self-insure get to choose what kind of healthcare plan designs and benefits they offer. They own their plan's data, so they gain a better understanding of how benefits are actually being used and how to build plans that promote a better climate of health and well-being for their faculty and staff. As we said, small and mid-sized schools haven't been able to take advantage of this type of plan financing because they lack the number of faculty and staff necessary to accurately predict and price their claims. That's why many schools are coming together in a partially self-insured healthcare captive arrangement that creates the size and scope needed so they can enjoy the same advantages as those large institutions. Is being partially self-insured right for your school? Well, that depends on your demographics, your tolerance for risk, and how much control you want to have over your benefit strategy and financing. At Captivated Health, we're experts in helping you to assess your risk and creating customized solutions that get you off the fully insured roller coaster. We've saved schools millions of dollars, even with our conservative approach to pricing and risk management. If you'd like to learn more about this exciting financing arrangement for your school's healthcare needs, the Captivated Health team is ready to help you enjoy all of the advantages those large groups have used and benefited from for years. Call us today at 978-802-7000. Captivated Health, where the greatest wealth is health.